The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be speaking with Cheryl Petersley. She is a SHIP counselor out of Butte, Montana with the Southwest Montana Aging and Disability Services, and she is going to be covering everything we need to know about Medicare. We're going to talk about the Medicaid unwinding period. We're going to be talking about those wonderful helping programs that Montana has to offer, and we're going to be talking about the upcoming open enrollment period. You're not going to want to miss that, so please stay tuned.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare summary notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we're going to be speaking with Cheryl Petersley, who is a SHIP director out of the Southwest Montana Aging and Disability Services. Cheryl, thank you so much for being here with us today.
Thank you for having me.
Absolutely. And Cheryl, we are going to talk about one of my very favorite, and I think one of the topics that I think people have the most questions about is Medicare. So tell me a little bit about Medicare. I know that Medicare can sometimes feel like an alphabet soup with your A's, your B's, your C's, your D's. Tell me a little bit about Medicare.
Right. And so there's, of course, Medicare A and B are the original. A is covers hospital, and B is pretty much anything else except drug, outpatient, doctor visits, flu shots, anything like that. Sorry, did I interrupt you?
Sorry. No, you're good.
Okay. And then Part C is actually if people decide to go with a Medicare Advantage plan, which they still have to have A and B, but it just kind of takes the place of Medicare in the billing process. Several companies offer that option. And then if they don't go with an Advantage plan, then they need the Part D, which is the prescription drug plan coverage.
Wonderful. So prescription or your Medicare Part A is sort of your disaster coverage, your inpatient hospitalization.
Yes.
Part B is sort of like what you could consider more like your normal insurance, which is all of your inpatient visits at the doctor's office, things like that. And then our Part D is our prescription drugs. Do I have that right?
Yes, ma'am.
Okay. When do we get Medicare? Do we get it at 10? Do we get it at 30? When do we get it?
Well, it depends. Normally, you don't qualify until you turn 65.
Okay.
But there are several people, if you qualify and have been on Social Security disability, we've seen people in their 20s, young people on disability. Once you've been on disability, I think it's pretty close to 2 years, Social Security automatically signs you up, enrolls you in Medicare A and B.
Okay.
And they come to us like, what's going on?
So how does one apply for Medicare? Where do you start that process?
if you're turning 65 and you're already on your Social Security, taking your Social Security benefits, the Social Security Administration automatically signs you up for Medicare A and B, unless you don't want to take, then you have to let them know if you don't want it at that time. If they're still working, not taking their Social Security, then they can either go to the local Social Security office, they can call Social Security, they can set up a ssa.gov Social Security online account and do it online as well. So depending on their, if they have Wi-Fi level of, comfort with a computer, that sort of thing. So.
And your Part A, that's pretty general. Everybody gets the same Part A. Is that correct?
Yes, and that covers hospital. Everyone, there is no premium for A.
Sure.
Unless you have not worked, it's about 10 years of your life. So for the most part, there's no premium for Part A.
Okay.
And for people that haven't worked, it's pretty high. And I'm not sure, like $400 or $500 a month. So.
Okay. And how about Part B? Does everyone get the same Part B, or are there plans that you can choose for Part B?
Everyone will get B. The premium right now is almost $165 a month. If it automatically comes out of your Social Security, or they bill you in a 3-month increment. But it's $165 unless people have made in the last 2 years, I think for a single person, it's over 90,000 in the year. It's quite high. We don't get a lot of people that have that income. It's called IRMA anyway, income related. They add, it's not going to be 165, it's higher.
Sure.
Depending on your income.
And then there are multiple Part D plans, correct? So that everyone is choosing the one that fits the best for them. Is that correct?
Exactly. And that's all pretty much driven by their drug list, prescription drugs that they take on a regular basis. Doesn't cover over the counter, of course, like regular insurance. But right now in Montana, I believe there's 24 different choices. So it all goes by their drug list. Yeah.
Sure.
Ranging from like $5 to $100 and something a month. So quite a range.
So if people have questions about how they choose that Part D plan, how they compare those drugs, where do they go?
They hopefully come to us. Social Security office will send that, we in our area, we're like a block from the Social Security office. So they'll send them, or they call, and we make appointments and kind of go through everything, walk them through their options. You can take A and B and a drug plan. Also, we throw in the mix, we have general information about the supplemental plans.
Sure.
And that's private insurance, so we don't sell that, but just general information about that's an option that people can do as well.
Sure. So if folks aren't in Butte, can they call their local SHIP counselor?
Yes, and I should have that 800 number in front of me.
That's okay. We'll put it on the screen.
Okay. Yes. From all over the state, if they call that 800, I should have it memorized, but I don't. But depending on your, your area, not area code, but where you live, if you call from a landline, it will go directly to that area agency. I believe there's 10 area agencies in Montana. So, of course, we get different, with cell phones, and people can keep their same numbers. We try to screen people when they call. Are you calling from, we cover 6 counties.
Sure.
And then send them to the right area on aging. So
wonderful. Well, Cheryl, when we get back, I want to talk a little bit about the Medicaid unwinding period and also a little bit about the helping programs. So make sure you stay tuned because we'll be right back.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmers market.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
Welcome back to Aging Horizons. We're speaking with Cheryl Petersley, and she is a SHIP coordinator, and she is going to tell us all about the Medicare program. So we've already gone through those A, B, C, and D alphabets. But now I want to talk about a little bit about what folks do if they are struggling to cover those co-payments, those prescription drug costs, even their premium rates. Where do folks go? What can we do?
Oh, sorry. So there are there are several assistance programs. If people income and resource based, there is what we call the Medicare Savings Program. It's through the state of Montana.
Okay.
There's three different income levels. Resource level is the same for, different for a single or a couple. But if they qualify for both the income and resource limits, we can help them apply, or they apply through the state. But anyway, it's just paperwork and information they need, and then the state will pay that Part B premium, the $165 a month, which is awesome for people, low income, because that's a lot. If you
that can be a huge
$800 a month, right, or or less. Yeah. So that through the state and pays that premium. And then there's a program called Low Income Subsidy, or Extra Help, which is a little bit higher income and asset level. That helps with their drug plan, either an Advantage plan if it has a premium, or for the standalone drug plans. But it will pay up to a certain amount for the premium, as well as if they qualify for the full Extra Help, it covers a lot of their drug costs, lowers their copays phenomenally, amazingly, and gets rid of the deductible and the donut hole, or coverage gap. It's just amazing, and it will really help lower their drug costs. So that's something we help people. That's through Social Security. Some people automatically, when they come onto Medicare, qualify, through the Social Security Administration, but we help people apply all the time. And then if they're still, over that income, there's another level. It's just called Big Sky RX through the state of Montana. It's funded by tobacco tax. So I tell people, if you've smoked all your life, you've actually paid for it. But anyway, and it's a higher income level. They do not count resources, and they just pay the premium, but it's some sort of assistance, if the people do not qualify for the lower income levels.
Absolutely. So. And that's something that people shouldn't be afraid to apply for, right? They can come down and fill out that application. And is it 3 different applications, or do they just need to fill out essentially one set of paperwork?
It's actually 3 separate. The low-income subsidy is nice because you can do that online. Well, and actually with SkyRx now you can do online as well. So, but it's separate, 3 separate things we have to do, but it doesn't take a whole long time.
Sure.
And then, it also, besides, so once you sign up for a drug plan, if you qualify for the extra help, it gives you extra time in the middle of the year that you can change a drug plan. If, say, middle of the year you get a different prescription, it gives you every quarter they can change their plan. And with the Big Sky, it gives you 1 extra time in the year. So they're not stuck with the plan until the end of the year during the open enrollment.
That's a really important benefit for folks. That's wonderful. And then folks can just call that SHIP number again to get in touch with a SHIP counselor to help them fill out those applications, correct?
Exactly. Yes.
Wonderful. Cheryl, I want to talk a little bit about something that we've maybe all been reading about in the news, which is the Medicaid unwinding program. I understand this is having an effect on Medicare beneficiaries. Can you walk us through that?
Yes. So back in April, I want to say, anyway, when the pandemic was deemed over, everyone that was on Medicaid received a letter from the state just saying, now that the pandemic's over, we're going to reevaluate your situation, your income, your resources, and that sort of thing. Because during the pandemic, they couldn't kick anyone off of Medicaid. So people are getting letters, and then as their month comes along, which we've talked to several people just in the last couple of weeks, their recertification with Medicaid, then they have to do more, turn in more paperwork, bank statements and such, proof of any kind of, again, income and resources. And then they're reevaluated. Some people are fine. A lot of people are losing their Medicaid, because say they inherited some money since 2020 or, that's just one example, but they're over income. They started working, they make, whatever, they're over income or resource, then they get a letter saying you will lose your Medicaid effective for this end of August or whatever. Then they have time to kind of reevaluate. Do they want to stay with just Medicare? They have a chance. They're able to now get onto a supplemental plan or, buy into a supplemental plan. They have what they call guaranteed issues. So they can't look back on, if they have lots of chronic health issues. So
it gives people a chance to sort of transition onto Medicare.
Yes, transitioning, yes. And some just put their, send in the paperwork and they're fine. They still keep Medicaid, Medicare is still, they have to have both. Of course, they're called dual eligible.
Wonderful. And then anytime folks have questions with that process, they can also reach out to a SHIP counselor, correct?
Exactly.
The SHIP counselors are really just the jack of all trades, and we appreciate you so much in this state. Well, Cheryl, when we get back, I want to talk a little bit about the open enrollment period. So make sure that you stay tuned because Cheryl's going to give us all those important dates that are coming up soon this fall. Thank you.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline Montana.
I take care of my wife at home. When I found out training was available, I said, sign me up. It's made a huge difference.
When my husband was injured at work, it was life-altering. The classes taught me that it's okay to grieve, to ask for help, and to better cope as a caregiver.
My dad lives 4 hours away, and the Powerful Tools classes taught me that it's okay to ask for help. I highly recommend them.
To find out about this course for caregivers, go to powerfultoolsforcaregivers.org.
It's amazing the difference a little training can make.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting, increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
Welcome back to Aging Horizons. Today we're speaking with Cheryl Petersley, and she is giving us the rundown all about what you need to know about Medicare. So we have already gone through the A's, the B's, the C's, and the D's of Medicare. We talked about those low-income subsidies and those helping programs, and now we're going to transition into talking a little bit about open enrollment periods. So Cheryl, what is an open enrollment period?
So the general open enrollment period for the drug plans is between October 15th and December 7th. We always suggest to people, even if you love your plan that you have now, to revisit that and either call us and make an appointment, or a lot of people, if you're savvy on the computer, just go into Medicare.gov and just make sure, update your drug list, make sure that that's still going to be the best plan for next year. It's also the one time that people, if they're over income and do not qualify for any of those assistance programs we talked about, can actually change the plan. And that's in October, first part of October is the time when all these plans can and do, for the most part, make any changes they're going to make for the following year. And so people come in and we just, if they come to our office, we sit down with them, go over, update the drug list, make sure that their current plan isn't, all of a sudden their premium's going up 3 times, or, they're not making lots of changes. It's still the best plan for them for the following year. And then whatever we enroll them in, or they enroll in for the following year, starts January 1 of the next year for their new plan.
So open enrollment is that period of time where you can go in and elect a different prescription drug plan, a different Part D plan.
Yes.
Wonderful.
Yeah. Or Advantage plan too. Yeah.
And when we are looking at those drug formularies, it's really important to get sort of an updated list from your pharmacist, the drugs that you're going to be on for the upcoming year. Is that correct?
Yes. And so if people have a doctor, we kind of suggest, well, maybe wait till after you see your doctor, if it's in November, or, just to make absolutely positively sure, that nothing's going to change majorly for the next year, following year.
Absolutely. You got to do a little bit of research this time of year.
Right.
Wonderful. Cheryl, we have talked so much about SHIP counselors and what they do. I'm a huge fan of SHIP counselors, but can you just give our audience a little bit of an overview of what the day and the life of a SHIP counselor is?
Mm-hmm. Sure. So, of course, transitioning people from, what we just talked about, Medicaid to Medicare, a lot of Medicare drug plan information, just going over people's options and walking them through all their options when they are coming onto Medicare. But other than, we are also information and assistance. We're a resource center. So we help people pretty much, any kind of paperwork. If people get paperwork and they're overwhelmed or don't understand, just make an appointment, come in, 2 sets of eyeballs. Sometimes we'll just go over what they need to fill out or what they need. Also, if people have any issues with strange doctor or hospital bills, anything they either expect Medicare fraud or they just don't understand, they're getting billed for something that, we can also sit down and help them maybe call these, call the providers, and sometimes, most of the time, it's just a mistake, or they haven't billed all their insurances or whatever, but we walk people through that. Our office, I kind of stepped away from that because I'm so busy, because we're, of course, always shorthanded. But we offer senior commodities every other month. And so our director and then his assistant do that. So people, if you're 60 or over, and you qualify income-based, can come and pick up a couple of boxes of food, and then we also help people access the food bank. Give them, if they need any kind of information, that sort of thing. I don't know. It seems like I'm always busy.
A lot of hats there.
Yes. And we give out the packets if people have questions on the supplemental insurance, which we don't sell because it's private insurance, but we'll hand out packets, for people to look over. And I get my notes because I'm not sure. I can't remember. Oh, and then any kind of community resources like home health agencies for, people with aging parents or, spouses. Just home health information, that sort of thing, hospice.
Is there a fee involved in working with a SHIP coordinator?
No, we are a private nonprofit, so, there's no fee. We do take donations, but, we don't charge a fee because we get funded by what we do through the state and, federal government.
That's a lot of really important and valuable services that are available in the community and communities all across the state. It's wonderful to know that there are local advocates who are so knowledgeable that you can reach just by calling 1-800 number and just reach someone in your community.
Yes.
That's so incredibly important. Cheryl, if you had just some advice for folks who are looking at this upcoming open enrollment date, what would your advice be to folks to prepare for that?
I would say, if they go on the computer and do their own Medicare.gov, go over everything and then just look at that after the first part of October and make sure that the plan you're on is still the best plan. If it is the best plan, you do nothing, it rolls over to the next year and you're fine. But we, again, always suggest people, maybe if it's confusing at all, or if you don't have a computer, of course, just call our agency or the 800 number, wherever you are in Montana, and the SHIP counselor can at least walk you through it. And let you know, kind of assure you, yes, you're in the best spot, or maybe you need to change.
Wonderful. Cheryl, thank you so much for being with us today and for all of this really important and valuable information. I really appreciate your time. And so the takeaway from today is make sure you give your SHIP counselor a call with any questions that you might have. Thank you for staying tuned.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.